Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I hope by participating in these podcasts, you can take away valuable information that can enrich your life. We are always looking for topics of interest, so please email us at oakbendhappyhourpodcast@obmc.org. Today, I want to welcome Dr. Enrique Garcia-Pena, an orthopedic surgeon with the Oak Bend Medical Group. Dr. Garcia-Pena was born and raised in San Juan, Puerto Rico. He received a bachelor's degree in biology from the University of Chicago and a master's degree in medical science and research from Boston University, after which he returned to Puerto Rico, graduating summa cum laude from University of Puerto Rico School of Medicine. He then completed his residency in the orthopedic surgery in the Medical Sciences Center and his fellowship training at the Baylor College of Medicine and Ironman Sports Institute in Houston, Texas, where he also served as assistant to the team physician of the Houston Texans, Houston Astros, Houston Rockets, Houston Dynamo, University of Houston Athletics, and area high schools. He specializes in arthroscopic and minimally invasive procedures of the shoulder, elbow, hip, and knee, with particular interest in the treatment and prevention of ACL injuries and cartilage restoration procedures. Welcome, Dr. Garcia-Pena.
Thank you. It's good to be here.
Great. So during this time, and really all times, but particularly now, people seem to be more sedentary and not moving around and those kind of things. People's joints are hurting. People are getting stiff. Their knees seem to bother them. But oh my goodness, we've heard of knee replacements and nobody wants to do that. Can you enlighten us on our joints and what we can do?
Well, fair enough. Motion is life, and the joints are made to be used, right? Joints are made for movement. So, and the body adapts. Quite rather quickly to your level of activity. So if you become sedentary, the joints become sedentary, and you're going to lose motion. You're going to lose strength, right? So ideally, you want to still continue with an active lifestyle. Focus on joint mobility, getting out there, exercising, not only for your joints, but obviously for your heart. And when all else fails, then there's always the possibility of obviously getting a joint replacement, but there are several steps before we jump to that stage.
Okay. So we need to exercise and we need to move our joints, but people's knees maybe are stiff or it hurts to walk or whatever. What is it that we can do to help be a little more mobile and relieve some of that pain?
Of course. So first of all, the first idea, like you mentioned, if you're in pain, you're not going to walk. You're not going to want to move. You're not going to want to walk. So the first stage is to minimize your pain and the joint inflammation. So that we would need some supportive measures like ice, some topical medications, some oral medications you can get over the counter, like ibuprofen, naproxen, allopathic or osteopathic remedies that will generally decrease the inflammation in the body. Another thing we can do, which nobody likes to hear, is losing weight. Any pound is felt 3 times in the joints of the lower extremity. So each pound you gain, you feel 3 in the knee, pretty much. So after we decrease the inflammation and we decrease the pain, then we start getting you active. First, we try to ideally get you good range of motion. And after that, we'll start getting your strength and your function back. And if you can't do it by yourself, we have more very highly trained professionals in all our rehab facilities that are glad to guide you in that journey. So all you have to do is if you need help, just raise your hand, reach out, and we'll be glad to help you.
So I heard you say icing.
Yes.
And I've heard in the past heat. How do I know heat versus ice?
Right. Heat is for the muscles and help increasing blood flow. So heat helps relax muscles and increase blood flow. Ice is to decrease the inflammation. So I always tell patients you would heat the muscles and ice the joints. I'm okay with usually the muscles might be a little bit tight, so a little bit of heat towards the muscles or definitely help relax the muscles and let you move a little more effortlessly. But ice is strictly for the joints in this setting, of course.
So I'm going to kind of make this broad for you to talk about. So we have children that are in these specialized sports now, softball, baseball, football, and they're doing this stuff nonstop,
Mm-hmm.
right? And then we have us older people that are kind of moving around and doing this. When do we come see an orthopedic? When do we come see a doctor?
I think the short answer is 4 or 6 weeks. Most soft tissue injuries, or most like small sprains and strains, run their course in 4 to 6 weeks. So at the end of a month, if you're still feeling the same level of pain or it's gotten worse, without a doubt, you have to go see somebody, get you checked out. Your body's pretty much recovery process to take care of most injuries in 4 to 6 weeks.
Okay. But if you have chronic like arthritis or any of that stuff, are you the guy I come to see?
Most definitely.
Okay. And what can I expect when I come see you? Are you going to want to take me to surgery right away?
Only if you want to. No. So obviously, I want to assess who you are as a person. What's your level of activity? And most importantly, what are your expectations? Like, do you want to just be painless and live just your everyday life and just stay active? Or do you want to play sports? Like, what is the level of athlete which you're trying to reach to? From that, we guide our treatment. So I would still follow the same footsteps we talked about before. We try to decrease the inflammation, decrease the pain, try to rehab you back to health. If you're still not happy, if you're still having symptoms, then we'll get some more imaging studies and we'll go further down that line of what's the best option for you going forward. But you got to tailor the treatment to the patient and the person and their ideals, what they're striving for.
Right. So I want to move into the kids sector. Do you see children?
Yes, ma'am.
Or what age group do you see?
All ages.
All ages. So let's say we have a 12-year-old young lady who's a softball pitcher and pitches maybe 6 games at a time, and her shoulder gets a little out of whack. When do we take our children? Because, you hear these kids playing ball and everything else and really working those joints and that kind of thing. And they'll put some ice on it or something. But these are growing kids. Is there a time when we need to kind of establish with an orthopedic?
No, of course. It's the same concept. And with the kids, it's even a lot quicker, right? So the kids, especially at that age group, heal much quicker than we do as adults. So I would say you'd have to, obviously, parents don't want to hear, shut them down or get them out of their sport at least for a couple of days, if not for a week or so, just to reassess how their pain changes, how everything improves, or maybe it doesn't. If after a couple of weeks we still see the same persistent symptoms, then you have to go get a professional evaluation. So that timeline of 4 to 6 weeks is true for children, but it can be even shorter.
Okay. So I heard once that you're a big fan of yoga.
I am. I'm a fan of maintaining your mobility. That's correct.
Okay. And yoga is one of the better exercises for maintaining mobility?
Yes. Pilates, yoga, some rehab facilities incorporate a lot of isometric strength training, which I'm also a big proponent of. Yoga is traditionally a little bit far for what most people require or want out of their lifestyle. Not a lot of people have an hour and a half, 2 hours to dedicate to formal yoga posing and those kind of treatments. I'll use the word. So even simple adjustments and some stretching exercises and even weight-bearing exercises, body weight exercises, strength training exercises can give you the same benefits as yoga. But yeah, I definitely agree that maintaining your mobility is key to longevity.
So I have heard during this time of COVID and all this COVID going on, people are afraid to come to the hospital because they're scared they'll get COVID at the hospital. Would you like to reassure us how safe it is to have procedures and be at the hospital and to take care of yourself and not let it go and not let it get worse?
Of course. I think it's normal to be worried. You have to be prudent. Obviously, all hospitals, especially our hospital, which has been in the forefront of the COVID battle in this part of Texas, we all take all the necessary precautions, minimize touch, obviously wash our hands, obviously always wear masks. But I think as we start opening up in society, everything else has sort of tried to go back to normal. It's important then that you go see your doctors and you do receive treatments and you don't let things go by, because by the time you actually decide to go to the doctor, it might be actually too late to get some real help and see some real benefits. And on top of that, there's no excuse. If I see you go into the supermarket, you can come see me in the office. The hospital we're taking extra precautions more than they take at any other facility that you'll see out there. We're constantly being tested. We're testing anybody that has any sort of symptoms. We're testing all our patients before they even come in to get any procedures done. We're going above and beyond to make sure we're not part of the spread of this disease. So I think it's irresponsible if that's an excuse for you not to go see a doctor. You have to take care of yourself. You have to take care of your body so you can actually take care of your family.
Right. I agree. And I think by waiting, we make things worse.
100%.
And it's hard to go back once you've made it worse.
100%. I usually tell my patients, the time you've been out from your injury, multiply that by 2. That's what it's going to take you to get back to how you were prior to the injury. So you've been putting this off for 2 months. After we quote unquote get rid of the problem, it's going to take you 4 months to get back to where you were before. So the longer you wait, the longer it's going to take to get you back.
Okay. So you want to tell me about recuperation period for, let's say, rotator cuff. Mm-hmm. And how long does a rotator cuff last? You know, I've heard, well, it only lasts X amount of time and then you got to do it again. I mean, you want to clarify is there any myth to that?
Well, the problem is it's really patient by patient basis. So the rotator cuff, by the time you actually get an evaluation, it really depends on the viability of the tissue and how long ago was the cuff torn. You could be living with a cuff tear for years and not know about it. Or you could have a small injury and then tear your cuff. Now, that injured cuff that just happened has a more likelihood to heal after repair than the cuff that's been torn for several years. So that's also a very complex conversation. It really all depends on how long you've had the injury and how long you've had the pain and the symptoms and how long that cuff has been torn. So it really is very patient dependent, and you're going to hear great stories that are wonderful, and you're going to hear horror stories about revision surgeries and people that, had to have multiple surgeries to get everything fixed. So it's really, really patient by patient basis. And that includes obviously the age of the patient.
Are there any symptoms people can look for? We're in a big farming community and sports, and I'm sure people can tear their rotator cuff and not know it. But are there symptoms that would lead them to think, okay, I really need to have this checked because maybe I'm having these tingling feelings or something?
Yeah, of course. So inability to raise your hand above head or above shoulder level is one. Unable to reach behind your back without pain. And a big one is when you're actually feeling pain at nighttime, that it wakes you up. That's a big predictor that you probably have to go see somebody. Because very, very often, like the small strains or muscle strains, you only feel when you're being active. And with time, they'll go away and you sort of learn how to get around those issues. But when it gets to the point where it's bothering you at nighttime when you're trying to sleep and you're not even using your shoulder, that's a big telltale that you need to go see somebody for it.
Okay. And is surgery the only cure for that?
No, of course not. Ideally, depending on the injury, if the rotator cuff tear occurred acutely after an event, then most surgeons will recommend surgery at that point. Because it just happened, you were normal before, now you're not normal, let's get you back to normal. That's the train of thought. Now, if you didn't have any injury and it just occurred with time, then what we're going to do is we're going to try to strengthen and rehabilitate your shoulder back to normal. If that fails, then you're talking about the possibility of surgery. So ideally, it really depends on a patient-by-patient basis again. But ideally, our first intention when somebody gets injured is to try to rehabilitate and restore whatever they had prior to the injury.
I hope our listeners are really hearing this, because I think there's this fallacy of I'm going to put up with it as long as I can till I can't stand the pain anymore. But it sounds like you have opportunities to help if we get there early enough. Yeah,
100%. The rotator cuff is one where I wouldn't delay having it repaired or fixed. Because the longer you wait, the less likely you'll be able to get back to normal. The less likely you'll be able to get it to heal appropriately. So shoulder pain is definitely something you definitely pay attention to. And like I said previously, if you don't see any change in your symptoms after 4 to 6 weeks, which is what it takes your body to heal your regular sprains and strains, you should definitely seek some professional assistance.
Okay.
or at the very least an evaluation just to see what's going on.
Okay. And then knees seem to be another thing. I hear a lot about knees. What are the treatments for knee pain and knee besides knee replacement? Are there options, or what there can you do?
Of course. Well, same concept. First, we would try to decrease pain and inflammation. After that, we would obviously try to regain mobility, and after that, regain function through strength training, of course, like we said before. Now, the main difference with the knees is the fact that they're pretty much, the inflammation is more evident clinically, right? So a shoulder swelling is a little bit hard to tell. Knee swelling is fairly evident when you look at it. Like you could look at your knees and say, hey, my right knee is a little bit swollen today. What did I do? What's going on? Same concept. You would try to decrease the inflammation, decrease the swelling with ice, anti-inflammatories, obviously modify your activities. After that, then obviously trying to get into a good rehabilitation program, which you could do at home perfectly to try to maintain your range of motion and then go back to strengthening just to regain your function. So it's really the same concept with the added point that you can actually tell when the knee is swollen and when you should go see somebody for it.
So you hear a lot about people getting injections in their knees.
Mm-hmm. Exactly.
And you do the injections. You want to talk about that and what that does, or what it can do, or what are the benefits?
So it's the same concept we were talking about before in regards to controlling your inflammation and decreasing your inflammation and your pain. When the oral medications fail, then we have the added option of actually injecting an anti-inflammatory or a steroid into the joint, which will help with the pain, help with the inflammation, and be able to rehabilitate you more pain-free. Another option for the knee, but not approved for the joints, unfortunately, is what's called hyaluronic acid, which is a long sugar chain molecule that offers lubrication and some nutrition to the synovial cells. Some people call those the chicken injections. Others call those the rooster injections, just because the molecule was identified in rooster comb originally. But they're very helpful. They can give you longer lasting relief than just a regular anti-inflammatory and a steroid.
Awesome. So you don't want to wait. You want to get to an orthopedic so that you can have a quality of life. So maybe we can keep you mobile more.
Exactly. And don't feel like the surgeon has the right to push you towards a treatment. You're going to the surgeon as a friend for a consult, right? You're going to a friend to ask for his opinion. He's going to give you all the viable options and everything you can do. And then it's your decision, which you're going to make together with him, of what is your best choice of action. If you've gone through everything and surgery is the best choice, then he'll weigh that option with you. But don't feel like going to the surgeon or going to the doctor automatically is you're signing away your right to decide, or you're being pushed towards a treatment. You're going there to look at your options so you can decide and educate yourself on what's best for you.
Awesome. I know we've covered a lot of things today, but is there something that I didn't cover, or something that you would like to tell this public that they need to know, or you'd like them to know, or even about yourself?
Not really. I want them to come see me.
I agree. Dr. Enrique Garcia-Pena is located at the Williams Way Professional Building. He is in Suite 500, and he is taking appointments. He's an awesome orthopedic, not just a physician, but also someone that wants to get to know you and really make a difference in your life. Dr. Enrique, thank you for joining us today. And I want to thank all of our listeners for tuning in. Beginning now, set an intention and relentless focus on living your life as the greatest person you can be in all situations. Again, Dr. Garcia-Pena, thank you so much. We will be providing you with his phone number and everything else so that you can contact him and make an appointment. He will help you get back on your feet, moving your arms and taking care of your joint. Please join us next week for our podcast.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.